coronavirus pandemic has started to bring up just as many questions as it has answers. But apparently, if you dare to question what you're being told, you are just a conspiracy theorist who wants everyone to die. Well, I have a few questions about all of this. In fact, millions of Americans do. And if we're going to be told to hide in our homes, cowering in fear while millions lose their jobs and can't feed their kids, you better believe we have the right to question that. And you can call it what you want to. So here we go. Now, it's an indisputable fact that this is a bad virus. It's well documented that it disproportionately affects the elderly and those with pre-existing conditions. For people with compromised immune systems, it can easily be deadly. We get that. No one with half a brain is saying that this is just the common cold. But neither is it the bubonic plague. And if a country of 320 million people are supposed to keep sheltering in place, watching their bank accounts dwindle down and not being able to pay their bills and waiting on $1,000 government checks that are going to last about 4 seconds, yeah, you bet that we are allowed to ask some questions and we deserve some answers. In the past 3 weeks, we have lost 10% of our workforce. More than 16 million Americans have lost their jobs in less than a month. The feds are now projecting a 25% unemployment rate. That's insane. So here are just a few things that I would like to know if we're going to keep doing this. Question 1. The models keep changing, but the restrictions don't. Why? Here's a good example. In my home state of Virginia, experts had originally projected the state's coronavirus outbreak would peak sometime in mid to late May. Now that's been backed up to April 20th. The Institute for Health Metrics and Evaluation is now projecting 891 deaths, needing 319 ICU beds and 272 ventilators. But just a week ago, they'd projected over 3,000 deaths, needing about 1,000 beds and needing over 700 ventilators. Both of those models assumed full social distancing through May. But that's a massive difference. Even still, Virginia's governor has ordered a statewide shutdown of schools, non-essential businesses, and public gatherings through at least June 10th. Virginia is just one of many models that have proven to be way off the mark, which is somewhat understandable given the changing nature of these things, but even New York City's cases are already flattening. And as the projections become less and less dire, we deserve to know why we're still being told to hunker down and accept all of this as the new normal for God only knows how long. Because we cannot do this forever. Question 2. So about all of these death counts. Earlier this week, during the White House's daily press briefing, Dr. Deborah Birx explained that the United States is being liberal in how we're calculating the number of people who've died from COVID-19. Here's what she said.
I think in this country, we've taken a very liberal approach to mortality. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. If someone dies with COVID-19, we are counting that as a COVID-19 death.
So in other words, if a person dies, is tested posthumously, and pops positive for the coronavirus, that person's death is automatically listed as a COVID-19 death, even if there's a chance that they died from something other than this virus. Here's why this matters. For example, earlier this month, it was reported that a newborn baby in Connecticut had died from COVID-19. Here's CBS's headline. 6-week-old baby's death linked to coronavirus, believed to be one of the youngest fatalities. Medical officials said the baby tested positive for the coronavirus after death. Governor Ned Lamont claimed that we believe this is one of the youngest lives lost anywhere due to complications related to COVID-19. Except here's what the chief medical examiner had to say. At the current time, we have not issued a final cause of death. There are numerous tests that we must do on infant deaths before issuing a final cause of death. Even still, the baby's death was automatically listed as a coronavirus fatality. The world charged along, and we didn't hear another thing about it. But there's a big difference between dying with something and dying from something. And if we're going to keep pointing to a rising death toll to justify shutting down our entire economy and bankrupting millions of families, that death toll had better be accurate, and we have the right to question whether it is. Question 3, hydroxychloroquine, and why the media hate it so much. Several weeks ago, President Donald Trump said during a press briefing that 2 drugs, hydroxychloroquine, a malaria med, and azithromycin, might offer us a chance of combating the coronavirus. And the media lost their minds. Never mind that several medical experts agreed that there was a chance these drugs could do some good. Never mind that even New York Governor Andrew Cuomo has said that there is anecdotal evidence that they do work. No, that was a glimmer of hope in a very dark time, so I guess we better nip that in the bud real quick. At least that's how it seemed. Now, thankfully, even as the media slammed Trump for supposedly telling people to huff fish tank cleaner, which he didn't do, the National Institutes of Health are launching their first clinical trial into the use of hydroxychloroquine to treat COVID-19 patients. So with any luck, we might be on our way to a treatment plan. But it seems that even though the possibility of a cure, even the chance that we might be able to reopen the economy sooner than originally projected, the chance that our coronavirus death toll might be off, anything that might provide just a smidgen of light at the end of this forever long tunnel leading into economic despair and desperation, anything remotely positive is immediately squashed by the media and our leaders. And I can't help but ask, why? If Americans are going to be trapped inside their homes with no end in sight, alienated from their loved ones, if they're going to be stripped of their livelihoods, unable to pay bills or buy food, if churches are going to stay shuttered and business owners are going to lose their life's work, if students are going to get screwed out of sports scholarships and children are going to miss school, if we're all going to cower in fear for the foreseeable future, watching our economy crash and burn, we deserve answers to these questions. And yeah, you bet we have the right to ask them, because God knows the media won't. And that's your Reality Check, America. Make sure you subscribe to our YouTube page, like us on Facebook and Twitter, leave your own questions in the comments here, and stay sane out there.